Hi, this is Mr. Hove from Bluefin Vision. I'm going to explain to you the risks of ICL surgery today. So first and foremost, it's worth mentioning that the risks of any surgery are comprehensive, and all patients, when they're coming for surgery, we send them the informed consent document detailing the vast majority of risks in writing so that you can read through. I'm just going to go over the main risks for having ICL surgery in this video today. So ICL surgery is a fantastic operation, typically for treating patients whose prescription is higher than what can be treated with laser eye surgery. The first risk is because we're going into the eye, there is about a 1 in 10,000 risk of getting an infection in the eye, potentially a severe bleed when we're doing the surgery. The risks of both endophthalmitis or suprachoroidal hemorrhage are very, very small, in the order of less than 1 in 10,000. The next, which is more common, is that it is possible in putting the implantable Glaucoma lens into the eye of inducing a cataract, either because the contact lens comes into contact with the lens, or because of manipulation of the Glaucoma lens when we put it into the eye. So if you were to develop a cataract 3, 4, 5 years after you've had ICL surgery, it's almost certainly going to be related to the actual surgery itself. And we think that cataracts occur in ICL surgery in about 1 to 2% of patients. If unfortunately you were unlucky enough to get a cataract after ICL surgery, then we would need to remove the ICL, remove the cataract, and then put in typically a trifocal lens, which will still give you good distance, intermediate and near vision. It's incredibly rare that these things happen, but they can happen. And then the last thing to mention is that even though the ICL lens is made to order, it is possible that we put the ICL lens and it is either not quite in the right position and you need to go back inside the eye and rotate it. If it's a toric lens corrects for astigmatism, and because it corrects for astigmatism, a toric lens needs to be aligned in the correct axis to correct the astigmatism. So it is possible that you've put the lens in and you haven't ended up with it being in the right position, so you need to go back and reposition it. Or it is possible when you're doing ICL surgery that there is refractive error left after the operation. And what we mean is you start off with a prescription of -17, we've made it custom to order lens, and yet we've put the lens in, done the surgery as best we can, and yet your prescription is still -1 in that eye. In that situation, typically because ICL patients are young, we would often treat them with laser eye surgery. The laser eye surgery would correct the leftover refractive error, and it is included in the price of ICL surgery. Thank you very much for your time.